Hello, good afternoon, everyone. I'm Ira Ansari here for Wave Now. So, we are talking about something that is really exciting and a breakthrough in medicine. I don't know if you all know anyone who has been impacted by Alzheimer's. My grandfather had it, so I got to see some of how that impacted his life, how difficult that was for him and all of us family members who were surrounding him. So, recently, we just found out that there's a new study that shows the accuracy of an Alzheimer's blood test. So this information was published in the Journal of American Medical Association, and it shows the accuracy of this new simple blood test to detect Alzheimer's disease. It's a test that physicians at Norton Healthcare, their Neuroscience Institute Memory Center, they're currently using to help provide accurate diagnosis for patients. And the Memory Center director, Dr. Greg Cooper, one of my favorite doctors, he's going to be talking about this new study. We know that about 6.7 million Americans suffer from Alzheimer's disease in 2023. So this is exciting. We can get more information from Norton Healthcare. Let's listen in.
Better. It's still only about 70% accurate. So how can we improve on that? Well, there are different biomarkers. These are tests we can do to look at certain proteins in the body that might indicate a disease. And that can help increase our accuracy in Alzheimer's disease. But they come with problems too. We can do a PET scan, but that's not readily available to most people, not always well covered by insurance. What we usually do is a spinal fluid exam, and that's a minor procedure. People do very well with it. It's a very good test, but most people would prefer a blood test over a spinal fluid exam, a spinal tap. So this is looking at that, and I know it's a long-winded introduction, but this is an important step forward in really perfecting some of those blood tests. So in this particular study, they looked at a blood test looking at a couple different proteins, forms of amyloid and forms of phosphorylated tau. Those are the hallmarks in Alzheimer's disease. And they found that whether these were patients from a primary care clinic or from a specialty clinic, they improved their accuracy, their ability to detect Alzheimer's disease all the way up to 90%. So we improved from either 60 or 70% up to 90% with a fairly simple blood test. And this was shown repeatedly to be reliable.
Cool, because it's reliable, but a way bigger deal in the grand scheme of things, right?
It is. It is because, well, as newer medications become available, we had one approved a year ago. We had another one just approved earlier this month. We need to do a better job of identifying people very early on when they are the best possible candidates for these medications that we believe actually slow the progression of the disease. And let me back up just a little bit. It very often takes months, if not years, for people to receive a diagnosis. And there are a lot of reasons for that. And part of it is just poor access to specialists like us. But this blood test, if it, with continued development, may be a way to help us really shorten those times, to get people the right diagnosis, to get them to the treatment that may really impact this disease and really help them go forward.
Before I continue, does anyone want to jump in with some questions for Dr. Cooper? If not, I'll keep going. Yeah, because there's a couple of other things I want to touch on. To your point about taking a while to get diagnosed and the accuracy of a diagnosis, I think the way it works with this blood test, and if you could bring us up to speed on how you all are using it in the Memory Center, someone does need to show some symptoms of memory decline, right, for this to work?
So that is a really important point. If, hoping and presuming that I don't have any memory problems, right now, if I took this blood test, it may be very accurate at ruling out Alzheimer's disease, but if it shows some of the changes of Alzheimer's disease, that is not very reliable. We can't interpret that very well right now. However, if we show truly objective signs of memory loss, if I can make a diagnosis of mild cognitive impairment or dementia, so I can prove their memory problems, then this test is very highly predictive. It is a very accurate test. So it is important to at least establish not just a concern, but establish that there really are changes in memory before we should do and know how to interpret this test.
How does it work? Tell us how it works.
So typically, again, what you would do is some type of medical evaluation where we show that there are memory loss. That's usually just in the office. And then the blood test is like any other blood test we might have for cholesterol or blood sugar or anything else, except that we don't need to be fasting for it. And it's really that simple. Now, the test is not done in just any hospital laboratory around the country. For this particular one, it is sent off to a central lab, and some of the others in development, that would be true as well. So it is sent off. We don't get the results back usually for a couple of weeks. And the biggest barrier right now has been in terms of payment. So we are using this exact same test that was used in this study, and the results are really quite good. But payment is an issue. Not insurance does not always cover this, and so there is often an out-of-pocket expense. The hope is with studies like this, really proving that it may be every bit as effective as a spinal fluid exam, but easier, that the FDA will give approval for it. We can do the test now, but they give their stamp of approval. CMS, other insurance payers pay for it, and then it really becomes used much more widespread.
I think that's important, especially on the Alzheimer's dementia front, because you touched on some of the medication that you all are using, and now we're talking about this blood test, and it seems like insurance is a bit of a roadblock as it relates to a lot of Alzheimer's medications and treatments right now. Do you attribute that to just all of this being so groundbreaking and new and stuff that we're really starting to scratch the surface on?
I think mostly yes. Mostly it's because it's so new. With this particular blood test, uh, the work needed to be put in to show that it's accurate. And there are other blood tests that aren't quite at this level yet. And so it's fair to say if you have a new test, prove that it works. This and an earlier test from this year or earlier report really showed this particular test is very highly effective. So I think it is only a matter of time before insurance starts paying for it, and probably widespread. I think you're exactly right. It's just simply too new.
And if you have any questions, jump in or write them in the chat. If not, I have two more for you because I know you're joining us on a lunch break, and I'm very appreciative of your time. So,
My pleasure to be here.
so my next question was going to be about primary care doctors being able to use this and that piece of it all.
Yeah.
How does that change the game, if at all, for it to be accurate with their uses?
I think that remains to be determined. If I am a primary care physician or provider, and I am comfortable doing an evaluation and testing to confirm that there is some memory loss, then it should be relatively easy for me to order this test and to get a diagnosis. I think the rub is that comfort to some degree with doing cognitive memory testing and to some degree having the time. Primary care providers really just are already under the gun with a lot of things they have to do in a short period of time. So I think that will still be a bottleneck here. And I think in situations like that, it's certainly reasonable to refer to a specialist like myself. But you might argue to some degree, tests like this will help democratize the landscape. If I'm a busy primary care provider in a rural area, nowhere close to a neurologist, it at least gives me another tool in my armamentarium to make that diagnosis rather than to have a long wait time to get somebody in to see a specialist. So I think we'll see where it goes. I think it maybe levels the playing field to some degree, but there are still barriers as a field we have to work through.
And my last thing for you, before I open the floor one last time, is what does really this mean for the future of your specialty and where we head in Alzheimer's care?
I think this is accelerating things, really. Uh, I think I look at this a little bit similar to stroke, which has changed dramatically in my lifetime. When I was training, uh, there weren't really acute treatments for stroke, and we usually saw people in the hospital 24, 48, 72 hours after they'd had a stroke. We get acute treatments, and people gradually start coming in earlier when we have an ability to treat them. Well, now within the past year, we have one and now a second medication that changes the trajectory of the disease. It's not the cure, but it slows down the progress. It modifies the disease course. So that increases the sense of urgency to evaluate, diagnose people early on. This is another step in that process. This allows us to accelerate that evaluation so that hopefully now we are seeing people when they're still eligible for these treatments rather than later. The worst thing in the world is to tell someone, had I seen you 6 months or a year earlier, you might have been a candidate for one of these new treatments, and now you're not. Tests like this will help accelerate that process and allow more people to benefit from these therapies.
Okay, one last shout out to the crowd if anyone has any lingering questions for Dr. Cooper. If not, I will just ask you, Doc, if you have anything else that you want to. Oh, here we go. Coming from Melissa Patrick in the chat. What is the turning point for someone to not be eligible for the new treatments?
So that's a great question. There are a lot of criteria, but the one that really it tends to be an issue is the severity of the disease. We need to catch people when they have what's called mild cognitive impairment or mild Alzheimer's disease. It's all related to underlying Alzheimer's disease, but it has to be very early in the course. Once we transition into that more late mild or moderate level, then they're no longer a candidate for it. So it does come down to timing. I hope I answered that well.
Yeah, I think that answers the question. Let me ask you this really quick. For people who may be watching this either on Myra Stream or later today, and they're hearing what you're saying and it sounds pertinent, and they want to know where to go, where should we direct these folks to?
My usual answer is start with your primary care provider. Some are comfortable doing these evaluations. Some will make a referral. I think either way is acceptable, but you always want to have a good primary care provider you're comfortable with, and they can be a good starting place. Now, if that doesn't work, you're not getting the answer you want to, then reach out to a specialist, a neurologist, a geriatrician in your community. And not everybody, but many of us don't require a referral. So you could just call and make an appointment and be evaluated. And I would always argue if there is a concern and you've noticed a significant change, be checked out. If I spent all day, every day telling people they don't have Alzheimer's disease, that would be terrific. I'd rather err on the side of seeing people that don't have a problem and reassuring them than to miss a diagnosis and potentially miss the window for some of these treatments.
One more question did come in. I don't know if you can see it, but can you speak to people who are afraid of that diagnosis?
Yeah, and that's fair. And the truth is, I think we're all frightened of memory loss, of having a diagnosis like that. I would simply argue that not receiving a diagnosis, if you have that underlying disease, doesn't make the disease go away. you can't ignore it. It will catch up with you eventually. But now we have opportunities to take a proactive approach. Maybe we can't cure it, but we can do things that meaningfully impact this disease and can meaningfully impact and promote our quality of life. So it is an awful diagnosis. I can't take that away, but we can't help unless we take that first step. And so always keep in mind there may be things that we can do. Don't run away from that.
Hey, Nick, can I ask a question?
Absolutely.
Dr. Cooper, do you foresee this kind of being like the standard at some point, kind of like, a mammogram or a colonoscopy, like as a preventative tool or a way to kind of catch something early and treat it so the long-term effects are not bad, if that makes any sense?
No, it makes perfect sense. And I'm going to answer this in two ways. So today or this year, no. The answer is no. You would not want to do this test until we have already shown that there is some degree of memory loss. So that's true in 2024. Now, this is my own personal belief. I believe that we do move to a point where we do tests like this at the age of 50 or 55, like a colonoscopy. And if it shows that we have evidence of amyloid in our brain, we start an anti-amyloid treatment. We remove that amyloid, and it prevents us from ever developing Alzheimer's disease. That's my hope and belief. And it's not just me. We're actually participating in studies to see if that is really true. So that is a future state, and I believe we actually get there. In the short term, we would reserve this test for people that we've already found some degree of memory loss. That's long-winded. Does that make sense?
Perfect sense. Thank you so much.
Sure.
Okay. Any other questions? One last cast out to the group. Thank you for those who did ask a few questions. Dr. Cooper, again, thank you for your time, because we know it's valuable and you're always willing to give it to us. So
it's my pleasure. And these are exciting times in my field. I love to be able to talk about these important steps forward.
Yes, and more to come for sure. Okay. Definitely. All right. We'll let you get to lunch. Thank you, everyone, for participating. I'll get this recording to y'all shortly.
Good to see all my old friends from Lexington.
Yes. All right, guys. Be good. We'll talk to you later.
Thanks.
All right, you just heard Dr. Cooper give some really important information about this blood test that can detect Alzheimer's. They're using this blood test at Norton Healthcare, just how critical it can be in helping someone deal with that Alzheimer's struggle. So thank you so much for staying with me. A lot of good ground covered there. And Dr. Cooper is always an excellent interview. One of my favorite people to talk to. He has a wealth of knowledge in this field. Thanks so much. Have a great day.